Hi guys, do you hear me?
Yes.
Hey, done with clinicals? Yeah, some of you are still driving, right? Okay, guys, how may I help you today? What is the most concern?
We want help for our quiz this week.
Okay, I saw the discussion with Miss Tina. She said the quiz, she gave you a study guide for the quiz, right? And there is no chance to meet you before exam 3. So we decided to go over exam 3. Yes? The quiz, I look at the study guide she provided you, and it is literally, it is like no specific, like it's not deep in knowledge. We mainly, we want to focus more on knowledge, like respiratory diseases, cardio problem, blood disorders, like cardio, resp, heme. This is what is chapter 32 about. So that will be in exam 3. Yes, it is exam 3 Vinegar, and this is a big part of your points. It is 10% of your points. So that's why we decided to go over cardio, heme, RISP, and oncology, which is a chapter 32. This is my understanding. I want to make sure everyone is okay with that, and you really want to get the help with the exam. Or do we agree? Yeah? I want to hear from you.
I'm okay with that. It's just that a lot of us are very concerned about 1350, so we want as much help as we can for it.
Okay.
We appreciate you. Thank you.
Sure. Absolutely. Okay, so let's review for 1350 whatever you learned so far. And that will feed your exam 3. Yes? I didn't dig in whatever in the quiz because I got that quizz's very small points. And for sure, when we discuss these, it will help with the quiz as well. Okay, let's do it. Okay, so we have until, I'm going to give you until 6 p.m. So it will be 1.5 hours. So let's make it very condensed, 1.5 hours. So this is, guys, for 1350 exam 3. I will start with respiratory. Your exam. Let's start by cardio, because I know cardio could be a challenge for most of us. So let's understand what is congenital heart diseases. So let's look at this. Let's look at this. This is normal heart. Understanding how the normal heart is, it will make us understand congenital diseases. The heart, it is how many chambers, guys, in the heart? We have 4 chambers, right? 2 chambers on the right, 2 chambers on the left. So the upper 2 chambers, we call them atrium. The lower 2 chambers are the 2 ventricles. So there are 2 ventricles, this one, and this one. They are ventricles. And the upper ones is this one and this one. We call them atrium. The heart has 2 sides. So if we can cut the heart into 2 parts, this is the right side and this is the left side. The right side, guys, it takes all deoxygenated blood from the body. So what deoxygenated blood means? Okay, guys, let me ask you this. We have 1.5 hours only, and there is a big amount of material I want to cover with you, so you will be ready for your exam 3 on 1350. I need your help. I don't have time to go to the chat to read what you will put in the chat. I want to hear from you. When I say something, I need reply, and hopefully it will be fast and cooperative meeting, so we can finish that much. I prepared for you really good amount of material. I want to go over it all. That will not happen if I keep like begging for answer or begging for reply. So I will appreciate to hear your voice, okay? So the right side, guys, the right side carry deoxygenated blood. So what deoxygenated blood means?
It's already circulated through the body.
Okay, and it has what? Carbon dioxide or oxygen? When I say deoxygenated means it has carbon dioxide. So what color now I am putting on the right side? What color? What color is this?
Blue.
It is blue. Blue means it has more what gas? More of carbon dioxide. So we have more carbon dioxide on the right side. Yes, let's all confirm that on the right side we have more carbon dioxide. On the left side, so the right side has more carbon dioxide, and that will be taken to what part of the body? This deoxygenated blood will go through this pulmonary artery. This is a pulmonary artery. You see how I highlighted here? And that is carbon dioxygenated blood will go to what organ to get the oxygen?
The lungs.
What? The lungs. So we will go to the lungs. So all the right-sided blood, which is deoxygenated blood, will go to the lungs to get what? What gas is in the lungs? Oxygen. We have oxygen in the lungs. So the blood will take the oxygen from the lung, and the blood will give carbon dioxide to the lung. Gas exchange happen. Carbon dioxide goes to the lung exhale it out, lung provide the blood with oxygen. Then the oxygen is very important. This is what we look for. Oxygen will go back to the heart again through pulmonary veins, and it will be on the left side. So the left side of the heart is full of oxygenated blood. That's why I put the red color. Red color means it is full of oxygenated blood. So left side carry oxygenated blood. Then this oxygenated blood should go to the cells. It should go to your body so your body can function, your body can use the oxygen. So all the oxygenated blood will be pumped through a big blood vessel. We call it aorta. This one, the one I'm coloring here, this is the aorta. It will carry oxygen to everywhere in the body. So all oxygenated blood go from left side to aorta. Aorta will pump all this blood to your body, even your toes, very far to your toes. Blood go to your toes from aorta. So what do you think, guys? The pressure will be higher on the right side or left side? Right side just a pump to the lungs. Left side pumps very high pressure to the aorta. So what pressure is higher? Right-sided heart pressure or left-sided heart pressure?
Left side.
The left side, because the left side pumps where? Far, very far to the aorta and then to the whole body. So we have higher pressure on the left side, okay? Then that will explain many things. Remember this word, higher pressure is on the right, on the left side. Also remember, left side carry oxygenated blood. This is good. This is a good blood we look for. Right side carry deoxygenated blood. This is the bad one, the bad blood which has carbon dioxide. Yes? Right side has more carbon dioxide, left side has more oxygen, left side pressure higher than the right side pressure. And the right side pump to the lungs. Left side pump to the aorta, to the systemic circulation. Yes? Then cardiac congenital heart disease. The first one we will review today is Fallot. Fallot, tetralogy of Fallot. It is tetralogy, means tetra means four. So tetralogy means we have 4 congenital diseases in one patient. Tetralogy of Fallot, we have 4 problems in one patient. What is a mnemonic for tetralogy of Fallot? The mnemonic is, it is in your PowerPoint for Miss Tina, the one she gives you. The mnemonic for Fallot is drop. Drop. D-R-O-P. So we have 4, 1, 2, 3, 4 anomalies or defects in Fallot, tetralogy of Fallot. Excuse me. So D stands for defect. D stands for defect. Defect like a gap. So it is VSD. D, look at this. D-R-O-P, drop. D means defect. There is ventricular septal defect. What ventricular septal defect means? What is the ventricle? Upper chambers or lower chambers? Ventricles are upper or lower chambers?
Lower.
Lower. So ventricular septal defect, like this is called septum. This wall, we call it septum. So ventricular septal defect means there is a hole between the 2 septum. There is a gap here. So the first problem with Fallot is VSD, ventricular septal defect. Second problem, how many problems we said it will be in Fallot? It will be how many?
4.
3 or 4?
4.
Exactly. First one is VSD. Very good. First one is VSD. Second R, right ventricular hypertrophy. Means the right ventricle is enlarged. Enlarged. Hypertrophy means enlarged. O means overriding of the aorta. Normally, aorta takes blood from what side? Right or left? Aorta takes blood from right or left?
Left.
Left. Mujabeng, left. So overriding of the aorta means aorta is overriding the 2 ventricles like this. Look at the number 3, aorta. Look at the aorta. It should only take blood from the left side. Now aorta takes from right and left because it is overriding right side and left side. So what blood is in the aorta now? Normally, it should be all oxygenated, but now look, it takes it from right and left. So what blood, kind of blood will be in the aorta? Oxygenated? Yes, it will be a mix of oxygenated and deoxygenated. Look at the purple color in the aorta now. So the blood is purple. It should be pure red blood because it should be full of oxygen coming only from the left side. But if there is overriding of the aorta, it takes the blood from right and left side. So the blood will not be purely oxygenated. And we said aorta pump blood where?
To the whole body.
Everywhere. The whole body. So the blood going to the whole body is not fully oxygenated. So Fallot, the tetralogy of Fallot, is it cyanotic or acyanotic?
Acyanotic.
Cyanotic means it will cause blue discoloration in the body. Acyanotic means no cyanosis. So what do you think? It will cause cyanosis or no?
Yes.
Yeah.
Yes, it will cause cyanosis. So tetralogy of Fallot, guys, is cyanotic. it will cause cyanosis, because this is how they ask you questions. Which one of the following is cyanotic? Which one of the following congenital heart disease is acyanotic? So now we know fallot is cyanotic because it causes cyanosis, because there is overriding of the aorta. Aorta take from right side and left side. Got it?
Yes.
Yes, perfect. Then we have number 4 in the tetralogy. We said there is drop. The P stands for pulmonary stenosis. There is stenosis, narrowing in the pulmonary artery, which take blood to the lung. So there is pulmonary cyanosis. Yes, so remember the 4 anomalies. Remember that fallot is cyanotic. Cyanotic, it causes cyanosis, right? For fallot patient, you always see the patient exhibit certain position. Like you will find a 2-3 years old kid squatting. They are running, playing, and they are active, and suddenly they stop playing and squat. Why they squat?
To increase the blood flow to the lack of oxygen.
Back to the heart. Good job, Raiden. To increase the blood going to the heart. So to increase the venous return. When they squat, they push the blood from the legs up to the heart. It goes through the veins. So that squatting increase venous return to the heart, increase the blood going back to the heart. Yes, so questions like that, guys. Why squatting? Parents asking, why my kid is squatting? Or there is a kid squatting, the nurse understand he's squatting because. You need to know why. That is a squatting position, increase the venous return going to the heart, so more blood will be in the kid circulation. If he is few months old and he's cyanosis, and he's crying, so cyanosis increased with crying, okay? He started to cry and he started to get more cyanosis, and you know he's a tetralogy of fallot. How to position this crying newborn to also increase the venous return to lower the cyanosis?
Leeches.
I will hold them like this and flex the legs. Flex the legs like hip and knee, flex them, simulating the squatting, but I am carrying this newborn, flexing his hips and legs, right? Again, to increase the venous return. So remember fallot, remember the drop, the 4 finding, remember there is cyanosis, it is cyanotic. Remember, if the child is older, he's squatting to increase the venous return. If he's a newborn and cries vigorously, this vigorous cry make him cyanotic, and then we carry flexing their legs. Remember, these cyanosis, it comes in attacks. We call it tit spill. Tit spills when they get cyanosis. Yes, they will look like this. There is circumoral cyanosis around the mouth. We call it circumoral, and there are cyanosis in the feet and the hands. Yeah?
Yes.
So remember, increase the venous return. Increase venous return is important when they get the tit spills to increase venous return. Do you see this? The one I highlighted here? Okay. Then, next, congenital heart disease. We call it next disease is coarctation of the aorta. This is the aorta, which pumps blood all over the body. Look here, what happened to the aorta? Twist. Do you see the twist? Do you see this?
Yes.
This is called coarctation of the aorta. It twists. The first part of the aorta, it gives to the upper limb. So the upper limb take innervation from the upper limb, take from the upper part of the aorta. Then the lower part of the aorta, it goes to the lower limb. Imagine if you have a hose, you're watering a plant and you have a hose and there is water in the hose, and then the hose is twisted. Okay. The pressure will be higher before the twist or after the twist. The water pressure will be before or after?
Before.
Before. Imagine if the hose is connected to the tap of water and there is a twist. There will be more pressure could go back to the tap. So the hose even will get dislodged from the tap of water. Yeah, so the pressure is higher in the area before the twist. So now, if you check the blood pressure in the upper limb for the patient, and you check the blood pressure in the lower limb of the patient, which one will be higher? The blood pressure will be higher in the upper limb or the lower limb? Look at Katie. Katie said upper limb. Yes, upper limb is higher because the pressure is higher in the aorta here before the twist. This area, it has higher pressure, and this supplies the upper limb. So the pressure will be higher in the upper limb than the lower limb. This is all about coarctation of the aorta. Okay? This is a finding the nurse expects if she checks blood pressure in a patient with coarctation of the aorta. Yeah. Next. Now I will discuss 3 diseases together, but they are different, okay? There is a disease called ASD, another disease called VSD. Okay, I will discuss both of them together, okay? Because they are very similar, but they are like, it doesn't come together. Patient either born with ASD or born with VSD. Number one, I want to explain this. How many sides we said the heart has? 2 sides, right? Right side and left side. Right side has deoxygenated blood. Left side has oxygenated blood. That's why you always see the right in blue, the left in red. Cool. What is the name of the wall between the 2 sides?
Septical.
Septum. Yes,
Septum?
it is septum. Yes, septum. This is the name of the wall. Okay. What is the name of the upper 2 chambers? Upper 2 chambers, we call them atrium. Atrium. Very good. Or atria. Atrium for single, atria for plural. Okay. The lower chambers, we call them what? Ventricles. Right? So again, the wall, we call it septum. The upper, we call them atrium. The lower chambers, we call them ventricle. Cool? So when I say there is atrial septal defect, atrial septal defect means there is a defect here in the septum between the 2 atrium. So this is ASD. There is a hole between the 2 atria. When I say ventricular septal defect means the defect is here between the 2 ventricles. Okay, are we on the same page, everyone? If yes, put thumbs up.
Yes.
Yes, okay. So this is ASD and VSD. They are 2 different diseases, but they are kind of like same problem, but this is here in the upper part of the septum. This is here in the lower part of the septum. Okay. In both diseases, either ASD or VSD, there is a hole, right? Since there is a hole, means the blood will go back and forth through this hole. Do you agree? Blood will shift through the hole? Okay. What do you think? Blood go from right to left or left to right? Let's go back to the sentence I mentioned earlier. What pressure is higher? Pressure is higher on the right side of the heart or left side of the heart?
Left.
Right.
Left. Yes, we agree. So the blood flow from where to where now?
Left to
Right.
right.
Left to right. Good job, Braden. Left to right. Because pressure is higher in the left, so that will push the blood from left to right. Great. Then, so let's write that down. Number 1 piece of knowledge here, in both of these diseases, ASD and VSD, blood shift from
Left.
left to right. Okay. Number 2, when the blood go from left to right, will be more blood on the right, obviously, right? More blood will go to the right side. Do you agree?
Yes.
So
Yes.
let's put more blood in right side. Right side feed or go to give what organ? Remember the first picture I
Lung.
showed you?
The lung.
Yes, good job. Right side take the blood to the lungs.
Lung.
Yes, so let's put here the third finding, more blood goes to lungs. Will that cause lung congestion? Yeah? If there
Yes.
is increase in the blood flow in the lung, that cause pulmonary congestion. So, question, which of the following disease cause pulmonary congestion? You might listen to pulmonary crackles, and they put you all Fallot, ASD, VSD, coarctation of the aorta, okay? And they ask you, which one cause increased pulmonary blood flow or increased pulmonary congestion? Which one?
So ASD,
All of the
VSD.
above?
No, not all of the above. Just ASD, like Radian said, and VSD. Did I say anything about increased pulmonary blood flow in Fallot?
Nope.
Did I say anything about increased blood flow in coarctation of the aorta?
No.
No, it is just the ASD and the VSD because there is a hole, makes the blood go from left to right. So when there is a lot of blood on the right, it will be more blood in the lung. That is pulmonary blood flow increase. Makes sense?
Yes.
There is one more disease have the same problem, like ASD and VSD. It also cause increased pulmonary blood flow. This disease, guys, PDA, patent ductus arteriosus. Let's look. What is patent ductus arteriosus? There is something called ductus arteriosus in the embryo, in the fetus. Not in the newborn. It should be only in the fetus. There is a duct between this, which is pulmonary artery, and this, which is the aorta. This duct, we call it ductus arteriosus. This has to be closed right after birth. Once the baby is born, this duct should be closed. We call it ductus arteriosus. It connects between the pulmonary artery and the aorta. Some newborn, they have a problem. This duct is not closed. It will stay open. So it is patent. So this is patent ductus arteriosus. The ductus arteriosus stay opened. Make sense?
Yes.
Now, again, there is an opening. So the blood will flow from place to place. What do you think? Blood flow from aorta to pulmonary artery or from the opposite way? Let's think the same way as ASD, VSD. We thought about the blood go from higher pressure to lower pressure. So which one has higher pressure, aorta or pulmonary artery? Which one pump blood far?
The aorta.
The aorta. The aorta for sure, right? Because pulmonary pumps to the lung, which is close distance. But aorta pumps far, even to your toes. So pressure is higher in where? Aorta or pulmonary artery?
Aorta.
Aorta. So blood flow from where to where?
From
aorta to pulmonary or pulmonary to aorta? From?
Aorta to pulmonary.
Exactly, from aorta to pulmonary. And that, do you think blood go from aorta to pulmonary make more blood go to the lungs?
Yes.
Yeah.
Yes. So this is the third disease which cause increased blood flow to the lungs.
Mm-hmm.
Yes?
Yes.
Know the three. And now you understand. I am not asking to memorize, but understand why. But if you don't understand it yet, write in your notes. ASD, VSD, PDA, the three of them increase pulmonary blood flow and the patient at risk of pulmonary congestion, period. Yes? Did we get that?
Yes.
Okay.
Finally.
I'm glad you got it. Okay. What do you think,
Oh,
guys?
really?
Again, the three diseases, ASD, VSD, PDA, the three of them, they are similar. Let
Mhm.
me know, what do you think? Are they cyanotic or acyanotic? Before you answer, look, is always cyanotic if there is more carbon dioxide going to the blood.
Mhm.
Are they cyanotic?
No. I don't
No
think-
reason, right? No
Yeah,
reason.
because the more
Yeah.
blood to the lung.
Because the blood more blood go to the lungs, right? And the blood go oxygenated, go to the area where there is no oxygen. I mean, fine, that's fine, right?
Yeah.
Yeah. So the VSD, ASD, PDA, the three of them are acyanotic. Acyanotic means no. A means no. Acyanotic. There is no cyanosis. No reason for cyanosis. But for Fallot, is it cyanotic or acyanotic? Tetralogy of Fallot.
Cyanosis.
Cyanotic. Because what is the reason? Because there
The
is.
mix of the blood.
Because why
Okay.
Fallot is cyanotic?
They're the mix of the oxygenated food and then the deoxygenated blood. So they mix together and then they pump
Exactly.
through the aorta.
Exactly. Because there is co-arcutation of the aorta. The aorta mix the blood, take from right, take from the left. So that is taking from the right, which is carbon dioxide, which makes cyanosis. So Fallot is cyanotic. Okay. What about co-arcutation of the aorta? Is it cyanotic or acyanotic?
Which is upper compound.
Cyanotic.
No,
Acyanotic.
That's no.
It is no reason for cyanosis. Good job. Yes. But what finding you will find in the co-arcutation, guys?
High blood pressure
Unequal pressure.
High blood pressure where?
in the upper
limb or low?
extremities.
In the upper extremity, higher than the
Lower.
lower
extremity.
extremity. Which disease the patient need to squat to increase venous return?
Tetralogy.
Tetralogy, Fallot. Good job. Yes, this is your congenital diseases, guys. Got it?
Yes.
Yes. Okay. Okay. So remember, guys, summary. VSD, nothing new here, just summarize. VSD, ASD, PDA, the blood shunt from left to right. Do you agree?
Yes.
So they are what?
More blood on the right side.
And they are cyanotic or acyanotic?
Acyanotic.
Yes. Do you see the slide?
Yes.
Yes. Okay. So oxygenated blood recycle. So the oxygenated blood recycles through the lungs that overburden the pulmonary circulation that cause pulmonary congestion. Yes?
Yeah.
With the congenital heart disease, if the kid cry vigorously, that will increase the pressure in the right side. When they cry vigorously, the pressure in the right side increase. That will make unoxygenated blood go to the left side. So crying will make them turn blue. If they cry, they will be blue coloration. If they cry only. Yes?
Yeah.
Okay. The last slide of congenital heart disease. In general, guys, in general, infant with cardiac disease, they easy to get fatigue. Imagine cardiac. So if the infant or the newborn easy to get fatigue because they are cardiac, make sure you offer bottle with big nipple so they don't exhaust themselves suckling from a small nipple size. Give them high calorie formula because they will not stay 20 minutes in each breast, you know, they don't have the energy to keep suckling for 20 minutes. You know, breastfeeding is how long? 20 minutes. These are cardiac newborn, they cannot keep suckling for 20 minutes. So make sure you just give them 5 minutes feeding and high calorie formula. Give them big nipples so they will not struggle and make effort. You will see them trying out during suckling. This is exhausting. We want to avoid them do the try out during suckling. Okay? Sometimes also they need digoxin. Remember, digoxin, you check the apical pulse. But remember, the pulse in the newborn are different. We always say hold digoxin if the pulse less than 60. This is in adult. But in infant is different. You hold the digoxin in infant if the pulse less than 100. Yes. If the kid vomit after digoxin, you want to repeat the dose, give another dose of digoxin? Never. You don't want to overdose. You want to check the blood digoxin level first. Sometimes cardiac patient like congenital heart, they get clubbing. So why clubbing happen with congenital heart? You will find a child and he's like, nurse, why my finger looks like this? And they are clubbing. What is your answer?
Chronic hypoxia?
Chronic hypoxia, Carolina. So they have long time of being low oxygen. Low oxygen chronically cause clubbing. Be careful though, not every cyanosis in a newborn means a congenital heart. Sometimes Apgar scores show 9 out of 10 because they have blue fingers and the toes. This is normal it to happen in the beginning. They are just trying to adapt to life, and these the opening which exists in the fetus, like ductus arteriosus, the foramen ovale, they take time to close sometimes. So having the fingers blue at birth is not always cardiac. It could be just they are trying to adapt to life by closing the opening which are in the embryo heart, and they should be closed when they get born. Yeah?
Yeah.
Okay. This is congenital heart disease, guys. That's it. So you will have, that's it. This is congenital heart disease. You know how I teach. Like I teach just this. This is what you need to know for high yield questions. Okay. This is what I do also with NCLEX. When I teach him for NCLEX, this is what I say, because this is the high yield topics. Okay. Then respiratory, guys. Respiratory. Let's talk about many things. Respiratory, because your exam will be cardiac, respiratory, and heme. Sorry. Exam 3 also will have some dosage calculation, so make sure you review dosage calculation, pediatric dosage calculation. Okay, respiratory. Let's talk about epiglottitis. Epiglottitis, it is emergency because it might cause sudden airway obstruction. So let's look at the epiglottitis patient. This is epiglottitis. Please mute yourself. There is, I believe, Esmeralda, your mic is open. Okay, thank you. So epiglottitis, there is risk of airway obstruction. Let's understand what is epiglottitis. What is epiglottis, guys? Look, this is the airway. Air goes through the nose, through the mouth, then goes through the airway, trachea, down to the lungs. At the opening of the trachea, there is epiglottis, which closes the trachea during swallowing. So if there is food going through the mouth, this epiglottis just close the trachea. Normally, the epiglottis is tiny, is not that big. It is just a tiny to close this area. But now look, when it is inflamed, how big is the epiglottis? This is epiglottitis. And that will cause air will not go down. Airflow is not going down. So is this emergency? They cannot take the air. So airway obstruction. So if I see people, like if there is priority questions and you have many kids, which one I will take first? I will take the airway problem, which is epiglottitis. If I have pneumonia and epiglottitis, which one I will take first? Pneumonia is breathing problem. Epiglottitis is airway problem. Which one is more urgent here? More emergency is the airway epiglottitis, because there is blockage, a measure. So with epiglottitis, patient will have for sure fever. It is infection, so it will be fever. So let's write that down. No, 1 second. Epiglottitis will cause fever. It will cause them to assume certain position, and the position we call it tripod position. They go like this tiny guy. This guy is looking forward like this. Look at how he's like sitting. This is called tripod position. And they cannot swallow even their saliva. They cannot swallow their saliva. So they will have the saliva coming out. This is called drooling. So it will be fever. It will be drooling. They drool from the mouth, drooling. Whoa. Yeah, all out. It will be a tripod position. Okay. What you should never do. Patient comes with fever, sore throat, it will hurt in the sore, and drooling, tripod position. Never examine the throat. Because if you examine the throat, it will be more reaction, it will be more swelling here. So never try to examine the throat. It is swollen here. And I want you to differentiate between this condition and if somebody comes with fever, also sore throat. Let me add number 4 for this. It is no cough. There is no cough.
Oh, no cough. Yeah.
And there is no breath, no crackles on the lung. No crackles on the lung. It is all in the upper airway. Okay. So another patient comes with sore throat, fever. And when you examine the pharynx, when you examine the throat or the pharynx, there is pus on the sides, okay, at the tonsils. And also there is no cough. There is no cough and the clear lung sound. So what is the difference? This is number 1. This is number 2. This one, we know what is the diagnosis. What is the diagnosis is number 2. When they have fever, drooling, tripod, no cough, no crackles. This is epiglottitis. So if they have a patient with fever also, sore throat, but pus in the pharynx and the sides of the tonsils. This is
it the group like the chronic, like the group?
This is tonsillitis. It's caused by beta hemolytic streptococcus, strep throat. This is a strep throat, guys. Streptococcus, beta hemolytic streptococcus. Yes. So this is a strep throat. So strep throat is different than epiglottitis. Epiglottitis, there is airway obstruction. It is emergency. Yes. You need to know the two. You need to know the difference. You need to know the difference and the finding in each one. Makes sense? Everyone?
Yes.
With the epiglottitis, would there be stridor?
There will be stridor. Yes, absolutely. Thank you. Who's saying that?
Katie.
Number 6, Katie. Good job, Katie. Stridor. Stridor, yes, because there is blockage here, so there is grunting sound. There is a stridor sound. This is upper, doesn't come from the lungs, Katie. The lung is clear. Stridor or grunting, this is upper airway blockage. Very good. Very good. Never check the throat in epiglottitis. Never check the throat in epiglottitis. But if you check the throat and it is pus on the sides, this is pharyngitis. This is strep throat, the beta hemolytic streptococcus. Okay? Epiglottitis also, they have muffled voice. Their voice is muffled because there is no air going in to vibrate the vocal cords, so their voice is muffled, drooling. Yes, drooling, muffled voice. Anxious because there is no air going in, anxious kid. Yep.
Yes.
Okay. You guys, I want to make it, whatever I say, I want it to be understood. Don't just take notes and don't understand why. Because notes you will forget if you don't understand. Yes? You understood, right?
Yes.
Yes. Okay. Hit yes or no on the chat.
Yeah.
I want to see your yes. Raiden, you're good. Yes. Katie, I see her. Longo. Yes. Okay. Okay, guys, just make sure we understand it, not just memorize it. Good. Okay, after epiglottitis, I will go to where I am. Here. Tonsillectomy. Tonsillectomy. The tonsils are removed. When you get question about tonsillectomy, it will be post-operative care, if you get one. Post-operative care is very important because after removing the part of your throat, you cut, it's a wound, it's like cut, incisions, so painful. So you need to understand how painful it is. So give your patient codeine elixir as needed. If he has sore throat, give them to swallow codeines. Elixir, it's a liquid medication, codeine in a liquid form, because it is painful if they swallow pills. So give codeine elixir as needed. Also make sure they are not like doing this. What I'm doing right now.
Try to swallow.
Yes, frequent swallowing. I have dry mouth. So frequent swallowing after tonsillectomy, that indicates they might be bleeding. They are trying to swallow the blood. So when you're watching patient after tonsillectomy and you notice they are frequently swallowing, this means that there is a risk of bleeding. Check their throat. They might be bleeding. Also, you may offer things which calm down the pain, like you give them sips of cold water, you give them Popsicles. Don't give hot drinks, and don't give them something red in color, like red jello, that because the red color might be, if they vomit, they have red color, you will not know if they bleed or if this is a jello they just ate. Give them, yes, jello, but not red color. Don't give them pudding or anything like milk product, like yogurt, pudding, because after yogurt or pudding, they might need to clear their voice. So that trying to clear the voice, that could cause damage the stitches in the throat. Yeah.
Yes.
Watch him for distress or difficulty breathing after tonsillectomy. Okay. Asthma patient, asthma, it causes expiratory wheezes. expiratory wheezes, like when they check the breath sound, it's expiratory. Asthma causes respiratory acidosis because asthma entrap the carbon dioxide. They cannot breathe that all the air, so they entrap carbon dioxide, so they get the respiratory acidosis. If you're taking care of a patient with asthma and the patient started to have diminished breath sound or absent wheezes, will be something good to have absent wheezing. He was just wheezing a couple minutes ago, and I'm checking on him right now, and there is no wheezes, absent wheezes. It will be something good. That means the medication is working, so I will document that. Or what do you think? If there is absent wheezes. Good.
There's not
Atelectasis?
breathing?
There's something wrong, Katie. Yes, so it is not good. This is called silent chest, means they getting into respiratory failure. So if patient with asthma, he was wheezing and suddenly he stopped wheezing, suddenly, this is not a miracle. This is not because you give the wonderful nursing care. This is a complication of asthma called silent chest. You need to talk to your provider. Call the provider. Don't document and keep assessing. Nope. Inform the provider. Notify your provider. This is dangerous. This is called silent chest. For asthma, they take albuterol, they take the meter dose inhaler with steroid. Make sure you ask them to rinse their mouth to prevent what? Why they rinse their mouth after steroid inhaler?
To prevent oral thrush?
Exactly, to prevent oral thrush. That is great. Okay, so expiratory wheezes. Okay. Respiratory distress syndrome, guys. It is common in premature kids. Yes? So, if you have a premature kid, newborn, and they got respiratory distress syndrome, what the nurse expect will be injected in their trachea. They always, respiratory distress syndrome, they have endotracheal tube. They intubate them in endotracheal tube. So what the nurse expect will be injected if you have a premature newborn diagnosed with respiratory distress, what they will inject through the trachea. What are they missing?
Surfactant.
They are missing surfactant. Good job. Good job. So endotracheal surfactant. They will inject them endotracheal surfactant. Why respiratory distress common in premature? And they frequently have, after that, they will be frequently having croup. Very simple answer. Very simple answer. Because their airway is tiny. They have tiny airways.
Mm-hmm.
Yeah, it's premature, means they have tiny airways. That's why frequently croup after respiratory distress, they frequently having croup. What is croup?
It's chronic.
Croup, it's a big word. It is laryngotracheobronchitis. Because the airway is, number one, you have the larynx. It will be like this, the voice box. Then you have the trachea, the windpipe, right? Then you have the bronchi, your bronchi, and then the lungs, right? So croup is laryngotracheobronchitis, means the larynx, which is the top, trachea, and the bronchi, all of them inflamed. So all this area is inflamed. This is croup. Yes, and common in the in the premature, because premature they have tiny airway, they are tiny, so it is common to get the croup frequently. Patient with laryngotracheal bronchitis or croup must keep NPO, nothing by mouth during the attack. Why? Why we shouldn't give them any food? What do you think?
Possible aspiration.
There is risk of aspiration. Yes, because they keep coughing, they cough frequently, and their cough is like barking cough. Yes, so remember the cough characteristic, it is barking cough. So NPO during the attack, because they have risk of aspiration. Should be placed in a mist tent with 30% oxygen. Yeah, they need to get oxygenated very well with 30% oxygen. They are listless because of poor oxygenation. They should not be taken out of the oxygenated tent during the attack. And remember the characteristic barking cough. So this is croup. Okay. So if you remember now, we finished epiglottitis and we compared the epiglottitis versus beta hemolytic streptococcal pharyngitis, right? We talked about respiratory distress syndrome, prematurity, and the croup. We're still in the RESP, okay? For RESP, remember the TB, guys, also. TB, if a child has TB, it needs to be placed in isolation room. What kind of isolation is TB?
Negative pressure.
Airborne or droplets?
Airborne.
That's TB airborne.
TB is airborne. So you put them in isolation room, airborne isolation precaution. Okay. If you have any respiratory patient and they have tracheostomy and they started to show restlessness, they are tracheostomy and they started to have tachycardia and being restless, what is your first action? Suction. Yes, very good. Start suction when they are restlessness. Respiratory problems like pneumonia, it might cause cyanosis, and we call it circumoral cyanosis. It is central cyanosis. In the premature kid, they have alveoli in 28-week fetus. They have tendency to collapse because there is no surfactant. Remember, so if they are premature and they born in premature, you expect that they will inject the surfactant. Okay, guys, this is RESP. Okay, so we finished the cardio and RESP. Got it?
Yes.
Next. Oh, we're done. I'm kidding. There is one disease in RESP called cystic fibrosis. We're not done this. Yeah, let's finish cystic fibrosis, guys. Okay, are you still breathing? Who stopped breathing? Benikar, did you stop breathing? Are you still breathing?
Yeah.
Okay. Okay, guys. So, cystic fibrosis. Let's understand. Cystic fibrosis, what is a problem in cystic fibrosis? Why this kid diagnosed with cystic fibrosis? What he has? He has a gene.
Too much mucus.
Too much mucus. Exactly, Mujabeng. Too much mucus, and the mucus is not only just mucus, Mujabeng. It is also thick, very thick mucus. Why it is very thick? Because it is loaded with chloride. Loaded with chloride. This is salt. There is chloride. There is a lot of chloride in their body because this is a gene. They have genetic issues, make him have that much chloride. Right, Zach? They have that much chloride? Yes. This chloride make the mucus very thick. Now let's think, where is the mucus in the body? Mucus mainly in the airway, in the digestive system, right? And in the genital system. Where is the mucus? Respiratory, digestive, reproductive, right? So think of respiratory. Kid with cystic fibrosis, their lungs will be full of thick mucus all the time. Imagine it is like a pond, the pond of water. If the water is full of chloride, like thick water, and it is stagnant, it is there, will the pond get infection frequently? Like the pond, the water will be dirty frequently? Absolutely, the water will be dirty. Same for the mucus in the lung. The lung, it has mucus and it is stagnant in the lung because it is sick. So infection will happen frequently. So cystic fibrosis kids will have frequent respiratory tract infection. Frequent respiratory tract infection. What you want to teach parents? You want to teach parents how to do cupping technique. Cupping, like have the chest, the chest of the kid, and do cupping like this. Yes, at the back of the chest to loosen the secretion. Cupping to loosen the secretion. This is my child back. I'm going to do cupping technique to loosen all this thick secretions so they can expel it out. Yep.
Yes.
Okay, so this is number one teaching. When they sleep, how they sleep? They should sleep upright or supine?
Upright.
Upright, so they can drain all the mucus. Give them mucolytics, something to dissolve the mucus. Exactly. And also give them high calorie diet because they are sick. They have been having cough, mucus, they have low appetite, lack of appetite. So give them high calorie diet. Usually cystic fibrosis happen in what ethnic group? African American or Caucasian? Don't say it. It is Caucasian. Caucasian. African American, it is sickle cell anemia. This is something we will hit very soon. Remember, the cystic fibrosis is a Caucasian descent, okay? This is a gene in Caucasian descent cause thick mucus everywhere in the body because of high chloride. How we diagnose this? What test we do to diagnose cystic fibrosis? It is sweat. Write the name of the test. What is the name of the test to diagnose cystic fibrosis? Sweat chloride test. No way. Guys, write it down on the chat. Sweat chloride test. This is to diagnose what?
Cystic fibrosis.
Cystic fibrosis. Sweat chloride test. You check the chloride in the sweat. Okay. Second thing in this cystic fibrosis, there is the sweat is salty. The sweat is salty because it is loaded with chloride, loaded with salt. So they have salty sweat. Then GI. There are enzymes produced in your digestive system to digest many things. I want to mention the pancreas. Look at the pancreas. This is the pancreas. Normally, the pancreas has a duct like this. It pours secretion in the intestine. So this is a pancreas, this yellow shape structure called the pancreas. It produces secretion in the intestine to digest fats. So if the enzymes here go to the intestine also is thick, will the pancreas will be clogged with these thick secretions? Yeah, so the pancreatic duct will be clogged with these secretions. So the enzymes will not go down to the intestine to digest fats. So what will happen to the stool if the fat is not digested? Cystic fibrosis patient, what kind of stool they have?
Oh no,
I'll give you choices. Is it
Steatorrhea?
constipation?
Not very too.
Steatorrhea. Good job. I heard that Carolina said steatorrhea. Write it down, Carolina, in the chat. Steatorrhea is fatty stool. Fatty stool.
Oh.
Because the enzymes are clogged in the pancreas. So they will not go down, the enzymes will not go down to the intestine to digest fats. So the fats will go down to the stool because it's not digested. Enzymes are entrapped in the pancreas. Carolina, do you know how to spell steatorrhea? Are you the one who said steatorrhea? Yes, she got it. So this is fatty stool. So how to intervene to solve this problem? We give the child something 30 minutes before meal. What we give? We need to give pancreatic enzymes replacement 30 minutes before meal. So patient with cystic fibrosis need to take pancreatic enzymes 30 minutes before meal for life, because this is how his body is, this is how his genes cause to his body. Yeah. And the last thing in cystic fibrosis, they have reproductive also problems, like they might have low fertility later because the semen is also thick. Yeah, so the sperms will be entrapped in the thick semen. So there's low fertility. Also, females have the same problem. The mucus, cervical mucus is thick, so the semen has problem to infiltrate into the cervical mucus. So the cystic fibrosis has infertility problem. So let's repeat, cystic fibrosis common in Caucasian. It's a genetic problem cause high chloride. So the high chloride will be high in the body. So all the body secretions will be loaded with chloride. So that will be thick body secretions. Mucus is thick, so the lungs will be filled of thick mucus, so frequent infection. Learn, teach cupping technique, give mucolytics. The GI, the pancreatic enzyme will be entrapped, so there will be fatty stool, so we need to give pancreatic enzyme replacement 30 minutes before meal. They have risk of infertility. Also, they have high salt in their sweat, so their sweat is salty, and this disease diagnosed by sweat chloride test. Who didn't get that? Who got that? Okay. Okay.
Got it. Okay.
Next.
Next.
Good job. Good job, guys. Okay. What is the earliest sign of cystic fibrosis? Like as a newborn? Something called meconium ileus. I mean, this is misspelled. Let me see the right spelling. What is meconium ileus?
Meconium, I know that one.
What is meconium, guys? What is meconium?
The first stool.
First
stool.
stool. Yes, this is the right spelling. Meconium ileus. This is the first stool. What is this meconium ileus? What is this?
We don't see anything.
It is paralysis of the ileum. Here, meconium ileus is the first sign of cystic fibrosis. They get this meconium ileus, which is paralysis in ileum. So the meconium will be also very thick. The meconium will be very thick, so it will stuck in the ileum, which is the intestine, and they will not pass the meconium. Meconium will not pass because it is so thick. So this is the first sign of cystic fibrosis. Does it make sense, guys?
Yeah.
Yeah, because once they are born, they need to pass a stool. They need to have meconium. Meconium will not pass. It will stay in the ileum because it is very thick, hard to be out. Okay?
Yes.
Okay. Okay. Let me check something really quick. So we finished RISP, cardio. Give me a second. You can guys have 5 minutes break until I look
Thank
at my
you. I need to go to the bathroom.
heme blood disorder. Okay. I will go back to the rest of the GI later. You didn't get the GI part with Miss Tina, right? Gastro, not yet, right? Did you get
Correct,
gastro,
not yet.
guys? Not yet. Raiden, are you in the bathroom? Don't take us to the bathroom with you.
Obviously.
I was about to say that.
I know, but I saw the comments, so I was like, oh, okay. Okay, GI is not yet, so I'm gonna skip GI. I'm gonna go hematology. Okay, guys. Hematology. Heme. Number one, in the hematology, what I want to say is know your CBC. Know your complete blood count. CBC means complete blood count. We need to know what is a red blood cell normal value, what is a white blood cell normal value, what is a platelets normal value. So know the numbers, guys. Study this, okay? Then you need to know the function of each. What is the function of red blood cell? To carry oxygen and the nutrient. What is the function of white blood cells? To fight against infection. What is the function of platelets? It prevents what? Prevents bleeding. Yes? So you might get lab showing CBC and they ask you the patient at risk of what? If I give you lab and I give you the white blood cells are low, so this is risk of what?
Infection.
Infection. If I give you labs and the platelets are low, so this is risk of
Bleeding.
bleeding. If I give you labs, platelets are high, this is risk of
Spots.
clotting. Very good. If I give you lab value and the red blood cells are low and the hemoglobin is low, so what is expected finding? The patient will show anemia, like pale, it will be pallor. This is anemia. Okay. So now you're the CBC. Iron deficiency anemia, guys. It is very hard to find a newborn less than 6 months and they have iron deficiency anemia. It cannot happen in a 6 months old. So iron deficiency anemia it has to be more than 6 months. Why? Why it cannot happen in 6 months old?
They still have some of their mother's stores of iron.
Mojabing, great job. So they still have storage of iron from their mom. So they will not get iron deficiency anemia. It could happen after 6 months, especially if they start to find, oh, formula is very expensive, the fortified one, because they need to get fortified formula, because fortified formula, it has iron. But now if they find formula is expensive, they cannot afford, and they will give regular cow milk. Regular cow milk that shouldn't be given before 1 year old. Plus, it doesn't have enough iron, so it will cause iron deficiency anemia. So it's a red flag if you see someone say, oh, the formula is expensive, I cannot get the iron fortified, I will give cow milk. That will cause iron deficiency anemia. Iron deficiency anemia, it will cause low red blood cell production, and that will cause pallor, fatigue, tachycardia. The heart will start to go very fast. Okay. Then, after iron deficiency, let's talk about sickle cell anemia. Sickle cell anemia, guys. This is problem in the hemoglobin. It's a congenital disease. It's a genetic problem. It is common in African American. So it is in the gene. What does the gene cause? The gene cause, there's abnormal hemoglobin. They will have hemoglobin S. It is abnormal hemoglobin. So this gene causes abnormal hemoglobin. This hemoglobin will cause the red blood cells will be sickle shape, like this. Normally, the red blood cell is rounded, well-rounded, and red in color. But with sickle cell anemia, red blood cell will be sickle shape, like this. Sickle. So look at this shape, the sickle shape. Is it easier to clump if they are sickle shaped like this, clump on each other,
Yes.
or if they are rounded like this?
If they're sickled.
When they are sickle cell,
Exactly. When are they sickle, it is easy to clump on each other. Imagine if they clump, what they will make?
Clots.
clot, embolism.
Clots. Exactly. The clots will block or obstruct the blood flow. So the sickle cell crisis happen when the blood clots happen. Sickle cell crisis, guys, when the blood clots obstruct the blood flow, and that causes swelling, painful swelling, especially in the arms and the feet. You will find the newborn kid, like he's 1 year old, very young, or 6 months, crying from the severe pain in the feet and the hands because they are swollen, red, and painful. Painful because there is obstruction of the blood flow because of the clotting which happened during the sickle cell crisis. Okay? How to prevent the crisis from happening? Is there a way to prevent the crisis from happening? Yes. I will say Hopper. Do the Hopper. H-O-P-R. H-O-P-R. H for hydration. O for oxygenation. P, give pain medication because they are in pain, and rest. Because if you keep them without rest, if you exhaust them, that will be low oxygen, and the oxygen cause more sickling. Low oxygen cause more sickling. Yes, so the Hopper, H-O-P-R, hydrate, oxygenate, give pain medication, rest. So if you have a sickle cell patient, are you going to take him to the playroom, or are you going to bring them Play-Doh to play in bed?
Bring them Play-Doh.
Play-Doh, because you don't want to exhaust them. You want them to rest to prevent the crisis, right?
Yes.
It is cold in here. Okay. Let's see what else. You guys, I appreciate your catching up while I'm going fast from topic to topic, but this is what the time allows. Okay.
Okay.
Let's talk about hemophilia. Hemophilia. Hemophilia is another blood disorder. Hemophilia. There is hemophilia A and hemophilia B. Simply, what is hemophilia? This is also gene. It is a gene problem. All of them are genes, like sickle cell anemia is a gene, hemophilia is a gene. Yeah. So hemophilia, there is hemophilia A and the hemophilia B. There are two types of hemophilia. What is a hemophilia problem, guys? Hemophilia, there is problem in a gene which cause lack of clotting factors. Lack of clotting factors. Normally, in our body, we have many clotting factors. We have 13 clotting factors. And they are numbered. There is clotting factor number 1, 2, 3, 4, 5, 6, 7, up to 13. So in hemophilia, there is deficiency in clotting factor 8 and 9. Hemophilia A, there is deficiency in clotting factor number 8. Hemophilia B, there is deficiency in clotting factor number 9. Again, there are two different genes, two different diseases, but they are similar in the outcome. The outcome is similar. So hemophilia A, there is deficiency in clotting factor number
8.
And hemophilia B, deficiency in clotting factor number
9.
9. The outcome or the end result, there is deficiency of clotting factor. So the outcome, there will be risk of
Bleeding.
That's it. Risk of bleeding. So in the hemophilia patient, there is risk of bleeding. So you need to start teaching parents about signs of bleeding, how to know that your kid is bleeding. Number 1, in the teeth, in the gum. Yes, gum bleed. What else, guys? What else could be signs of bleeding? You don't need to see like bright red blood coming out of them to say they are bleeding. It might be other signs, early signs. Yes.
Bruising.
Or bruising.
Bruising, easy bruising, mojabing, easy bruising. Good job. What else?
What is it?
Yes,
PTKI
you want to
something?
say petechiae. Yes, petechiae.
Yeah,
Good
petechiae.
job. These are the red spots under the skin. Purpura. It is also red spots, but little bit bigger than the petechiae. Yes, so the bruising, the purpura, the petechiae, gum bleed. Yes, so education. Use soft toothbrush. Avoid any corners with sharp edges. Avoid toys with sharp edges because they are easy to bleed. So this is hemophilia. Hemophilia. So sickle cell anemia, hemophilia, iron deficiency anemia, they are all heme. Blood disorder. What cardiac problem, guys, increase pulmonary blood flow?
Pulmonary blood flow is the
Huh?
AFP,
AFP, and then PDA.
Whoa. Whoa. Good job. Everyone heard that? Write them down on the chat, Raiden. Or anybody, write them down. There's 3 of them. Write them down. Write them down, Lonko. On the chat. ASD, yes, Katie, put 1. Yes, VSD, Katie, win. Katie, win.
Yeah.
The last one, Katie, go, go. Last one. Yeah, you just said them.
Peter and doctors.
Yeah, put it down. PDA. Good job, PDA. So these three increase the pulmonary blood flow. Good job, guys. What are the 4 structural abnormality happen in tetralogy of Fallot? You guys, write them down. Write them down. No. I need to write them down. The drop. Yes, write them down. The 4 problems with Fallot. Yes, they help each other. Each one will write 1. Yes, override them down. Katie, put 1. Pulmonary stenosis, Destiny. Very good. 2 more. 2 more. Come on,
So
guys. VSD, very good. Right ventricular hypertrophy, very good. Very good. Very good. Very good, Joanna. Sen, very good. Very good, guys. The 4 anomalies. Very good. Okay. Did you go over skin integumentary?
Not yet.
Not yet. So we
We go
covered
over the cognitive. Yeah, we cover the cognitive, but not
cognitive. Okay.
Yeah.
GI. Okay. So we did not talk about GI yet, or integumentary, or endocrine. Integ, GI, and endocrine. These 3 will also be in your exam. Exam 3. Majority will be on what we discussed. Cardio, resp, heme. And time is over. So we have not talked about GI or integ or endocrine. Miss Tina will cover that. Make sure you pay very good attention when she discussed GI, endocrine, and integ. But tell me, how do you feel about cardio, resp, and heme?
Very confident now.
Yeah, confident.
Better? Better?
Yes.
Good. The reason is you need to study, guys, in a simple form. Simplify things. Understand what you study. Don't try to just memorize. And repetition. You heard it once. Second time, it is better. Third time is much better. Yes, so try to watch videos on them. Try to go YouTube videos. I know Miss Tina, she give you very good PowerPoint. It has a lot of videos embedded. Watch these. When you go back, read that PowerPoint on these topics, it will make even more sense. Yeah, so make sure you repeat, because repetition is what make you feel better. And yeah, any questions for me, guys? Any questions? Okay, all the best. And just to let you know, I will not be on Thursday. There is no Thursday this week. I'm off work. This is the reason. So there is no Thursday. This Thursday meeting is canceled, and I will see you next week. Okay? Good luck, everyone. Study well. You can do this.